Good morning, ma'am. I am your student nurse. I am Dan Marciepes. This morning, I will be performing the assessment of the female reproductive organ. First, we're going to perform is the external genitalia. Second is the internal genitalia, and followed by anus and perineal area. And lastly, right. This morning, I have a improvised uh, presentations wherein I cannot find the actual patient. And I have here is the female external genitalia, and I have here the internal genitalia. So the first thing to perform is we need to have to gather all the equipments as necessary. If you're going to perform a vaginal examinations, we're going to use an equipment in using pap smear or chlamydial culture. So we have that using gloves, torchlight. So we have the iron spatula and everything to obtain specimen by or through pap smear. And then we have to explain the procedure to the client, to inform the client to be the procedure all about. And lastly, we have to gather the equipment. I have already gathered the equipment. I have here the gloves. And privacy to our client. So first, assuming that our client is in the lithotomy or the dorsal recumbent position, ma'am, can you please lie down, and can you please raise your both legs and flex your legs and relax. So this morning, ma'am, we will be going to perform the inspection, palpations of your external genitalia. So the first thing to perform is you need to inspect the mons pubis or the head distributions. So as you can see, in this case, my client has a good distributions of hair, and we need to inspect majora, so this one, and the perineum. So in this case, there's no any lesions, there's no any lumps, and there's no any unusualities being observed. And next one is you're going to perform or to inspect the labia minora. So in labia minora, you have to inspect the clitoris, so to check if there's any lesions, if there's any discharges, if there's any abnormalities or unusualities. And next, we're going to perform the perineum. So in this, my patient is gravida 1 para 1. She had been undergo episiotomy when she delivered her baby, and then there's a incision scar during the episiotomy. So it's about 1 year ago when she delivered her baby. So there's a scar on her perineum. And of course, we're going to observe the urethral meatus to check also if there's any lesions or if there's any discharges. And next one, so in this case, as I see it, so any abnormalities on her or any unusual abnormal findings on her external genitalia. Next to perform is the internal genitalia. One, so an internal, right? So we need to inspect, of course, the vaginal opening. Okay, we need to inspect the vaginal opening by slowly inserting your finger. So assuming that I have inserted my finger to check, okay, the size, the vaginal opening. And number 2, and next is you need to assess the vaginal musculature. So this one, we're going to ask the client while inserting my finger. So she must squeeze and then she must bear down to check if there's any bulging. Okay. Next one is, so in this case, I've asked my patient she can be able to participate during the vaginal musculature procedure. And next one is perform the bimanual examination. So in this case, by placing non-dominant hand on the lower abdomen, so in inserting glove, lubricant, index, and middle fingers in the vaginal opening. So we need to apply pressure to the posterior wall. So in this case, we have to observe if there's any secretions that being withdrawn. Alright, so in this one, so assuming that your client is participating during the bimanual examination. In this case, so there's no any pain, there's no any tenderness being observed. Next one is to perform the rectal vaginal. Okay, so in the rectal vaginal examination, so we need to ask client to bear down, insert index finger on the vagina and middle finger. So this one, so I will be wearing a gloves. So during examination, so assuming that I have inserted my this one, okay, to check also if there's any abnormalities, if there's any abnormalities, what you call this, or fistula, if there's any fistula in which there's an abnormal connections of these two specific parts of the internal genitalia. So in this case, while performing the vaginal musculature and bimanual examinations and rectovaginal examination, so there's no any signs of abnormalities, there's no any bulgings, there's no any pain while performing the procedure. So in this case, the patient has a normal findings. And now it's going to perform the anus and perineal area. So in this one, so we need to check, alright, around the anus, okay? Yes, during the anus and the perineal area. So the anus and the perineal area is close to is very close to each other. So in order to perform, we need to check the conditions. So we need to check if there's any redness, if there's any rashes, if there's any lumps, masses, discharges, if there's any scars, alright? So of course, during you need to inspect the sacrococcygeal area, right? If there's any ulcers, if there's any what you call this, there's any wound that is existent already. So in this case, right? So the patient, okay, the patient has a normal findings. We also need to check the tonicity of the anus, of the perineal, because this is the area where it has to be firm and strong, right? Because this area is one of the is among of those has a strong muscles during the contractions or during the urge to defecate. So we need to check that. So in this case, there's no any signs of abnormalities or unusual. So in this case, my patient is under normal findings. Alright, next to perform is the rectum. Okay, in the rectum, you need to palpate the mucosa for tenderness, irregulations, and nodules and hardness. Alright, so this one, I need to palpate the rectum. So ma'am, can I palpate here? Okay, just it may feel discomfort, but I need to relax. So assuming that I have palpated the rectum, so in this case, there's no any irregularities, hardness, there's no any lumps or masses that are present in the rectum, around the rectal area. So, and then if necessary, palpate the peritoneal cavity for tenderness, nodules, or if there's any, inspect the feces. So in this one, I need to ask our client if necessary, if the client can be able to participate during the inspecting of the rectum. Since we need to check if there's any fecal infections. So So in this case, so the patient is willing to participate. So there's a normal findings. So in this case, we have performed already the external genitalia, and the anus and the perineal area. So all in all, there's no any abnormalities, there's no any unusual findings during the assessment, and there's no need to there's no need or further examination because my client has a very normal structure in the external and internal genitalia, and having those examination, right, by asking the client to bear down. So in this case, so there's no any problem, right? So ma'am, thank you so much for your participation. So you may now ask the client to get up and explain to the client what could be the remarks and the results. And after this, so I will be doing aftercare. So I need to remove my gloves. And also this is very important, okay, during the vaginal examination if necessary. Alright, you need also to check the doctor's order if it is necessary for you to obtain a specimen for the vaginal examination. And that is very optional. Alright, so this is my assessment for the female reproductive system of the external genitalia, internal perineal area, and the rectum. Thank you so much.